Welcome to Healthcare Matters, bringing you the latest insights and innovations shaping the future of healthcare. This episode is powered by Arab Health in partnership with M42. Today, we're talking about this shift from healthcare to health. And how do we transform this healthcare system that's focused on being reactive to one that's focused on prevention and wellness and sustainability? Joining me today is Albarah Elkhani, Senior Vice President at M42. And today we're talking about the challenges of this reactive healthcare system we have today, the real potential of precision medicine and personalization, and the role that artificial intelligence and genomics will play in that transformation. Albarah, how are you?
I'm good, thank you, Peter. Thank you so much for having me on the podcast today.
I'm looking forward to this conversation. I feel like we can cover a lot of ground and talk about a topic that is very much front and center here in the region, I've noticed. But, I know in healthcare we like our definitions and our terms, and sometimes we use terms a little bit willy-nilly. But I feel like it's important to clarify. Oh, you tell me, is it important that we make this differentiation between the term of healthcare and health?
Yeah, I mean, that's an excellent question. I think it's fundamentally critical that we define the difference between healthcare and health, because by defining healthcare and health, that shows us where the challenges lie and how we have to have a paradigm shift in changing the way we operate. So healthcare traditionally is a system and a legacy approach to dealing with illness and symptoms. So by definition, you are waiting for the problem to happen, the disease to appear, and then you start dealing with the outcomes of that disease. But you're not addressing the root cause of what is causing that disease and how can we prevent or predict that. So having that mind shift and the entire system, the healthcare ecosystem, shift to a health ecosystem of looking at well-being, looking at prevention and prediction is critical for the sustainability of not just the healthcare ecosystem, but also the well-being of individuals to live longer and healthier. And that buzzword of longevity, I think is, everyone uses that longevity. While longevity by definition is living longer, but we really need people to live longer and healthier to reduce the burden on the healthcare ecosystem and governments globally.
I think about this a bit because, there's a lot of healthcare that's being delivered today already, and in some parts of the world, it's a relatively good healthcare system. I sometimes think, is it like, what's the burning platform here? Like, why do we need to make this shift? Is there going to be a big problem that we can't address if we don't? Or is it just things that we should be doing that we're like, oh, if we don't, that's okay? Like, where are we on this, like, level of, we need to do something now?
So it's a long-term chronic issue, but it's actually an acute issue as well. So if we take some simple statistics, our contribution of GDP to healthcare is exponentially growing globally. And the inequality between providing healthcare in, let's say, more developed countries to underdeveloped and the developed countries, the gap is widening significantly as well. Because the amount of resources required to deliver quality healthcare provision in the traditional way we deliver healthcare is significantly high. So there is going to be a significant inequality in healthcare provisions, and also a contribution of GDP to healthcare is significantly growing. So there needs to be an immediate shift in the way we approach healthcare provisions. Again, if we look at the person, the individual, and not the patient, I think we need to be very critical here, not using that word patient, because patient by default means illness and sickness. We need to look at the individual, how we empower, democratize what we do, from an information perspective, to empower the individual to make those well-being lifestyle changes that impact their health and well-being throughout their lifestyles, and also, more importantly as well, reduce overriding cost towards the healthcare provision because it's not sustainable.
Well, that's things we need to be doing at an industry or an ecosystem level across all of healthcare. It sounds like a topic that you're super passionate about. So I imagine, this is central to a lot of things that M42 do, right? Talk me through a little bit more about some of the initiatives that M42 is running to really contribute to this cause.
So M42, our strategy is an integrated ecosystem. So if you take personalized, preventative and precision medication, healthcare provisions, What we need to do is, first of all, have the information available to us, our physicians, and our patients to empower them to make those critical decisions. So we look at the entire life cycle from discovery of new diseases. So therefore, we're trying to predict and prevent diseases prior to happening through our clinical trial units, and all the way through our multi-omic data generation approach. So M42 were fortunate enough to be the operators of the Emirati Genome Program, which has a faceted approach to looking at prevention and longevity. So a small example of this is that we can use the Emirati Genome Program, the genetic information that is available through the Emirati Genome Program, to screen individuals who are getting married, the premarital screening. This is the first global initiative which looks at over 845 genetic disorders, inherited rare genetic diseases. So if we're able to actively educate the next generation that this is a risk associated to this marriage and offer them solutions to circumnavigate that risk, we're actually eliminating or significantly reducing the next generation of rare genetic disorders. That's just one small but impactful program that M42 with the Department of Health of Abu Dhabi has institutionalized. Now, what we look at is also we understand that the genetic information we have is what we inherit from our parents, and that is stable throughout life. But what really affects us is the environment and how our genetic information is translated into our health. So a prime example of how the environment affects us is like cardiovascular disease, chronic diseases like cardiovascular disease, diabetes. With the technology we have, the cutting edge technology like proteomic analysis, we're able to risk stratify population level grade, and we're able to identify individuals at high risk of cardiovascular disease and diabetes in the next 5 years. But what's important about risk stratifying or identifying these individuals is not just by identifying them, but then is to intervene and then monitor their risk reduction. So now we're able to identify high risk individuals, intervene both medically and lifestyle changes, reduce that risk over time, and therefore reduce the sort of risk of disease burden on our communities. Globally, we're spending over $1 trillion on preventable diseases. And the operative word there is preventable. These diseases can be stopped. So we shouldn't be treating those symptoms. We should be treating the root causes of it. So that's really our ethos of how we're applying our cutting edge technology, our network approach at M42, and our vision across the life sciences.
Yeah. Look, I think about the power of some of that data or insights that might provide to an individual, because it's one thing to say, you know, you probably should be doing this or that in relation to your healthcare, but to say, well, you know, here are some information, some facts essentially that allow you to make informed decisions, or at least look ahead of the curve. So to be able to do that at scale, and those examples you provided is it can certainly provide that transformation. I think about other ways that technology is going to kind of help us in this move to more preventative healthcare models. And we're all excited about AI. Obviously, we'll take that as a given within healthcare. But tell me about like how you see the role of different technologies. We've touched on the omics side quite well, but you know, other emerging technologies and how they'll play a role in this healthcare transformation.
So one of our, I would say, the biggest challenges, I have a keen interest in Six Sigma and sort of quality and non-value added steps. So we have a term or a definition called non-value added steps. And this is taking an expert like a physician or a medical technologist or a nurse and asking them to do a lot of non-critical steps that is taken away from their time of delivering care. So by simple things, and there may be mundane things, but using AI to remove those non-value added steps within the workflow of a patient in the healthcare ecosystem allows them to free up more time to actually focus on the patient and deliver better care. So, for example, we're using a large language model called Med42 that we developed at M42. And this Med42's role is to really bring very complex insights from the information we have. And that's both clinical data as well as genomic data, and integrating these data sets as well, and giving the physician very simple insights to act on immediately. Traditionally and typically, this would be months of work to generate those insights. Now, in a matter of seconds, we can use Med42 to generate insights. And our vision is not just to take that information directly to the physicians, but give that information directly to the patients and the individuals themselves, democratizing the whole sort of umbrella of healthcare provision by giving as much simple insights directly to the individual, where they're empowered to make those changes and understand the complex nature of healthcare provision. And they work hand in hand with their physician, delivering better care for themselves and better health overall.
Yeah. Well, you think about it from a patient's perspective, the amount of information that's thrown at you or to be, and seeing different clinicians to be able to help them make sense of that or provide informed decisions, and like leaning into technology that can do that much better than what the humans can with the powers that we have. So yeah, power certainly on the clinician side, but also on the patient too. I remember speaking as well, seeing over at the M42 presence here that there's this One Health philosophy as well. Tell me a little bit more about what that is, because that seems super interesting.
The One Health philosophy, it's not a unique philosophy, but with M42, it's something that we can actually operationalize and execute because we're fortunate to have a significant amount of information that will help us drive this. So simply what the One Health policy is looking at the environment and finding causative agents within the environment that affect the human to create disease. So the link between environment and disease is what we believe is the sort of future progression when it comes to health provisions. And why that's critical is because today we understand that smoking, as an example, may lead to lung cancer. These are obvious causal agents from the environment, but there is so many other complex causal agents in the environment that really we don't understand the effects on us humans. So we have something called epigenetics, which is a translation of our genome into all of the systems that we have in our body that ultimately could lead to disease. And there's a scientific term called methylation, which is, in simple terms, is the light switch of a gene. It's an on or off switch, right? So if you turn off a gene, that could therefore create a disease, or you turn on a gene, that could also create a disease. And that correlation with the environmental stimuli, be it non-obvious environmental stimuli and methylation that switch on and off, would really make us understand the causative agents in environmental disease and therefore take public-led initiatives to reduce, eliminate, build awareness around it. And because we have an environmental science arm within the M42 ecosystem, we're generating millions and millions of environmental science data points by augmenting the environmental science data points, the genomic data points, and very critically, the clinical data points through Malefi. We now have a triangle of sort of data that's feeding into each other, and ultimately using a neural network and AI. And this is why it's critical to use AI, because these data are very complex and very challenging to pragmatically work through. We're able to now find causative agents from the environment to disease, and therefore support in government-led initiatives and awareness.
I mean, it's so exciting to think about the potential of essentially having the blueprint to an individual to be able to help behind the scenes, give you the best chance of being, the best you. I look at it today, sometimes it feels like these types of technologies or emerging solutions are available to those that are privileged to access that information, but the potential to be able to, utilize this capability at scale is huge. How do we get to a point where this type of information and capability is available to everyone everywhere? Because it's not just individuals in rural, remote locations or developing nations, but also understanding the awareness that clinicians have that these tools are available. How big's this gap, and how do we go about addressing it?
It is a real world challenge. It really is. Again, going back to the challenge we have within the healthcare ecosystem is the lack of resources to deliver the traditional type of care. So we need to address that globally, and every single individual within the healthcare ecosystem needs to take a portion of responsibility and accountability to address that. So that we believe categorically that this needs to be addressed. And we believe with the tools available to us today, and obviously the tools that will be developed in the future, there's an exponential growth in AI and applications. And healthcare is one of those industries that typically is the last to receive these type of advancements and innovations. And the simple fact is, because you're dealing with a human being, it's much more risk averse. You need to make sure that this tool that you're going to use to treat potentially a human being is very much validated and checked and what have you, while other industries don't have the same level of quality and governance required to bring an innovation into it. But what we're seeing now is that we're using these AI tools to simulate these environments within the clinical domain. So we're expediting the discovery and innovation process. But more importantly now is we're simplifying and augmenting these data sets. So historically, when you walk into a physician's office and a clinic, is that the physician would spend a lot of time looking back at your historical medical records, right? He takes maybe 10 or 15 data points to make a clinical decision to treat you. What we're seeing is we have hundreds and thousands and millions of data points that at a click of a button can address that clinical decision. So the physician now is much more empowered and knowledgeable and has all information available to them at milliseconds, when historically this wasn't available. So we're bridging the gap now by giving all the information to the physicians readily at point of interest, i.e. at the clinic side, bedside if needed, and allowing them to make very quick and robust and comprehensive decision making. That addresses the gap in, let's say, awareness, education, and access to data. Now we go into the inequality globally. It is critical that we look at bringing cutting edge technology to the world. And I think there is a drive from global regulators. Take the FDA in the US, for example. They're pushing for clinical trials to be much more diverse. It's very well recognized that 90% of all global clinical trials is conducted in only 10% of the world's ethnicities. So we're looking at personalized medicine here. We're looking at a conventional medicine for a small cohort applied to the entire world. So how do we address that disparity? We need to address that disparity by bringing cutting edge technology to these worlds, by bringing clinical trials to the underrepresented communities and ethnicities globally, therefore producing more precise therapeutics, reducing the cost of treating, as well as improving the health outcomes of individuals as well.
It's exciting thinking about what's on the horizon in the next, like that we're doing now or in the next 1 or 2 years. It's funny, like if we were talking about these types of things 5 years ago, they're the type of things you look at a 10, 20-year horizon, like what's on the horizon. So it boggles the mind to think, and I'd love to hear from you, like where you see the next 5 years, 10 years, like what's M42's vision for like this long-term play with the, as you say, the exponential rate of things changing in health?
We believe in a multi-omic, multifaceted approach to dealing with health and not just healthcare. We feel that healthcare provision in its traditional way of operating is an obsolete way of operating, because we believe this is not sustainable, and therefore we need to have a paradigm shift. So we are taking a much more multi-omic, multi-data approach to how we deal with our communities, how we deal with our patients, and therefore empower our patients and our physicians to be much more proactive. We don't want to keep the reactive approach to healthcare. We want to take a proactive approach to health. And that means more preventative programs, more predictive programs. We seem to forget that prediction is very critical in understanding disease patterns, and using the data that we have available to us and the tools that will be developed in the next 1 to 5 years, we feel we will become much more precise in predicting disease. If you're able to predict disease much more precisely, you're able to manage disease much more precisely and proactively. So that's one pillar of our strategy moving forward. And I mentioned this previously, that we believe in building an equitable ecosystem globally. And the only way to do this is to build a more sustainable healthcare ecosystem. Therefore, you're able to reduce that gap in inequity, because the resource requirements is not as high as used to be, and therefore you're able to provide these provisions of care globally. So that's number 2 in our strategy. We believe in cutting edge technology is very critical to keeping a breadth of what we're trying to do. And that's why coming under the G42 umbrella is very critical for us, because we have an ecosystem, a tool of suites of data and information and tools and scientists that will help us deliver this. But ultimately, we want to be much more proactive with our 3 Ps, our precision, predictive, and preventative health models. And again, I'm removing the care element. It's a health model strategy. So by underpinning those 3 Ps, using the technology we have, improving in the inequity provisions of care globally, I think this is really the sustainable way of providing health to our communities.
Such an exciting future. I think about all the things that M42 have already done to demonstrate this and the trajectory it's going. So really looking forward to continuing to see those updates. Albarah Elkhani, I really appreciate you making the time. Thank you so much.
Thank you so much for having me, Peter. Cheers, mate. Thank you.
And thank you for tuning into the Healthcare Matters podcast. This episode was powered by Arab Health in partnership with M42. Make sure you subscribe to Apple Podcasts, Spotify, and YouTube so you can catch all the future episodes. My name is Peter Birch. Thanks so much for joining.